Recovering from knee surgery is highly variable.
It was going to take forever to get better if I was ever going to get better.
There's got to be something out there besides a CPM machine, which clearly isn't helping me.
Active and aggressive with this thing, or I was going to need
I'm a guy that's not looking to relieve the pain. I'm a guy that's looking to get back in the game.
That downtime was not what I wanted.
We've spent the last 7 years perfecting the recovery system that takes variability out of knee rehab, so you can quickly get back to your life.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, I'm Shannon. I'm 57 years old, and I had a total knee replacement in my left knee 6 weeks ago.
After Shannon's first knee surgery, she used the X10 just for range of motion. She also had outpatient therapy. Shannon had her other knee replaced 6 months later. This time she only used the X10. She did not have outpatient therapy.
I had a total knee replacement on my right knee done 6 months ago. When I had that surgery, I used the X10 machine at home for range of motion, and I had home care and outpatient therapy following that surgery.
6 weeks ago, I had a total knee replacement on my left knee. The same surgeon who had completed the surgery on my right knee. This time I used the X10 machine at home for range of motion and strengthening, and I had no outpatient therapy or home care services. Part of the X10 Recovery program was I got to work with the coach on a daily basis, and my coach's name was Erin. Working with Erin was really different than working with a traditional physical therapist. I felt like Erin was a lot more invested in my recovery. She knew me, she knew what I was going through, and I feel like my recovery and my strength is so much better than the experience that I had with a physical therapist.
My name is Erin Rempher, and I am a licensed physical therapist assistant and a patient recovery coach for X10. I've been in the physical therapy field for 10 years. And I have never seen results like this. I've worked in outpatient, skilled nursing, and home care, and the results that patients like Shannon and other patients are achieving in range of motion gains and strength gains following surgery with the X10 are outstanding. If I wasn't here doing it and coaching these patients, you wouldn't get me to believe it for myself. Seeing their progress and their results gets me excited to work with these patients and to coach them because they're making phenomenal progress, and I'm able to be a part of that and to help motivate them. And the machine's presence in the home is able to give these patients the ability to be compliant with a program 3 times a day, every single day. Unlike all the other tools that insurance might be touting and providing to patients that are collecting dust in the corner because they're never being used. One of the fun things about being a coach for X10, and was especially true while I was coaching Shannon, was the fact that I get to form a really close relationship with these patients. Often I'm in contact with them multiple times a week. In Shannon's case, I was able to contact her daily. Her and I were both always very excited about her results. I was getting the data sent to me while she was texting me frequently throughout the day, sending her data over because she was so excited about what she was achieving and doing as well. We got to talk about other parts of her life and the things that she was able to achieve. We involved the surgeons as well. The surgeons are provided a report on a weekly basis to be kept in the loop on how each of their patients are doing. This allows the surgeon to make decisions based on how their patients are doing for how long they use the machine as part of their recovery.
If my surgeon would have been unwilling to write the prescription for me to use the X10 machine in my recovery, I may very well have thought about using a different surgeon.
Working at home with just the X10 and no physical therapy, in 4 weeks, I did the stairs. And I felt strong and confident doing the stairs. And I've been doing the stairs every day, which I haven't done in close to 2 years. When I went in for my 4-week checkup with Dr. Weir, he was so pleased with my results and my recovery at that point that he told me I didn't have to come back for 3 to 5 years. He totally did away with my 3-month follow-up appointment. That made me really happy. Another huge advantage of the X10 machine and having therapy at home is Michigan winters, who wants to go outside to drive to therapy? There are a lot of days I'd be really thankful not to have to do that. I love the X10 and I would recommend it to any of my friends or even people I don't know. It's the most convenient way to recover from knee surgery. You don't have people coming in and out of your home to do home therapy. You can do it first thing in the morning if you feel like it, or if you want to stay in your jammies and have your coffee and then do it, you can do it. Go to dinner with your kids and come home late. Do your third session of the day at 9:30 at night. There's no restrictions. It's totally up to you and what your schedule is, what you feel like. It's been an unbelievable experience. I wouldn't trade it for anything. And I would recommend it to anybody who's considering using it for recovery from knee replacement surgery.
I'm Dr. Justin Trosclair, host of two-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.